everyone. Welcome to tonight's webinar, IPSF and You. I'm Lucy West, your APhAASP National President-elect. I am very excited to have you here for this webinar tonight. Whether you're an international vice president or just interested in getting more involved with IPSF at your chapter, this webinar will certainly provide you with a lot of information. Now, before we get started, I want to go over some webinar procedures with you. You can see on your screen the audio mode menu screen. If you would rather dial in to listen to the webinar on your phone, you can click Use Telephone. Just dial the number listed on the screen, and then once you've been connected, follow the prompts, which will ask you to enter the access code followed by the audio PIN. Now, you're all muted at this point. You can follow along with the PowerPoint on the screen. If you do have a question at any point, feel free to use the raise hand symbol, which will allow you to unmute your line to ask your question. If you would rather, you can type your question into the box on your control panel, and we can answer them during the Q&A at the end or answer as we go through the presentation. Now, I have the pleasure of introducing Amanda Cavness from the University of Tennessee. She is serving on the International Standing Committee this year as our Student Exchange Officer-elect. Amanda, over to you.
Hi, thank everybody for coming to the IPSF and You webinar. This is our agenda for the night. We're going to introduce the new International Standing Committee members and talk about where you fit in the IPSF structure, APhA-ASP promoted campaigns and projects, and how you can incorporate that into your chapter activities. We'll also talk about IPSF opportunity for you as an individual and have time for question and answer. So here's your 2014-2015 International Standing Committee. Lucy West is our committee chair this year. Adrian is our national contact person. Nellie is our national project coordinator. Ashley is the current standing student exchange officer, and I'm the student exchange officer-elect. So let's start with, where do you fit in to the International Pharmaceutical Students Federation? So IPSF is the leading international professional organization for student pharmacists, representing over 350,000 student pharmacists from 84 countries. APhA-ASP is a full member organization of IPSF, which means all members in your chapter are automatically members of IPSF. And we also get one vote in the IPSF General Assembly at World Congress. Something unique about IPSF is that it is 100% student organized and operated. IPSF is divided into 5 regions, and there are 4 regional offices. APhA-ASP is in the PARO region. So the General Assembly is the highest decision-making body of IPSF. Then IPSF has its own executive board made up of a chairperson from each IPSF promoted project. Each project then also has its own coordinator and a subcommittee. Then here in APhA-ASP, you have your contact person, Adrian, who relays information from all the IPSF committees to you, and Ashley and myself, the student exchange officers who run SEP, and Nellie, who helps connect the project coordinators from the international level down to the chapter level. Then where you come in is as a local exchange officer if you're a host site for the student exchange program, and as a chapter international vice president, formerly called the IPSF liaison. So what if your chapter doesn't have an IPSF committee yet? Well, all you need is someone to be designated as the international vice president. You may have already had this person, but just call them the IPSF liaison, and some IPSF spirit. That's all it takes. Once you have an international vice president, what is your role? First and foremost, your job is to promote the public health campaigns promoted by APhA-ASP and put those into practice in your chapter. You can also work in any other IPSF projects that may fit in well at your school or college of pharmacy. For recruiting chapter involvement and promoting the student exchange program, you can use the resources on the Pharmacists.com website and the things provided to you by your International Standing Committee members to do the other two. So now let's talk about the APhA-ASP IPSF promoted campaigns and projects. The picture here is the 2014 Outstanding IPSF Activity Award winner from the University of Arizona. APhA-ASP promotes 6 of the IPSF public health patient care projects. Those are listed here: Tobacco Alert, Diabetes and Healthy Living, Pharmacy Profession Awareness, Medication Awareness, HIV/AIDS Awareness, and the Humanitarian Campaign. So we'll go through those one by one, talk about what they focus on and how you can implement those into your chapter. First, we have the Tobacco Alert campaign. This includes education about cigarettes, chewing tobacco, and any other products like that. The goal is to educate patients about the dangers of tobacco. You can coordinate with Operation Heart. Some chapters have a Project Breathe committee. You can coordinate those together to make bigger events and to work IPSF into your chapter. Some chapters tell us that they have a hard time finding a place to fit the IPSF events. They feel like they're overlapping. That's okay. You can overlap with these other committees to make larger events. Some ideas are to hold a health fair for the Great American Smokeout. You could include multiple committees and have separate booths set up. You could also have educational sessions. And to hold these sessions, there are additional resources on smoking cessation on the cdc.gov website. This would also be a great opportunity to educate patients about the risks associated with new e-cigarette products, as these are gaining popularity. The next project is Diabetes and Healthy Living. The focus here is pretty broad. It's anything including diabetes, heart-related diseases, and healthy life choices. So you can see there are a lot of ways that you could work in an event here. The goal is education and promotion of healthy lifestyles and treatment and prevention strategies for children and adults. So be creative and think of ways that you can also work in children and parents together in these events. Again, you can team up with Operation Diabetes, Operation Heart. Some ideas would be to hold interactive sessions teaching patients how to create a healthy meal, or you could host a joint parent and child event to educate about diabetes, how to reduce your risk of developing diabetes, and how to manage the condition with lifestyle changes. Something creative also is if you have a large Hispanic population in your area or any international population in your area, you could make a healthy meal plan based on what type of meals that international population would eat. So you can help them make a healthy living, realistic meal plan for them based on things that they would eat normally. The next campaign is the Pharmacy Profession Awareness Campaign. This ties in with a lot of other things that are going on, so it should be really easy to come up with lots of great events for this. The goal here is to increase awareness of pharmacist-provided healthcare services. You can coordinate with American Pharmacists Month, the Pharmacists Provide Care campaign, World Pharmacists Day, and the list goes on. And there are lots of great resources from APhA. There's a slide about that at the end. If you go to FIP.org, there's also more information about World Pharmacists Day. Some ideas here are holding educational sessions in retail pharmacies to let patients know all of the other things they could do at retail pharmacies other than just pick up their prescription. They can get important vaccinations, they can talk to their pharmacist about their blood pressure, their diabetes control, etc. You can also attend career days at local high schools, and educate those students about all the possibilities that come with being a pharmacist. You can also try to vaccinate public figures and have a picture in the newspaper, or maybe just a short segment on your local news to let the public know what all pharmacists can do as well. The next campaign is the Medicine Awareness Campaign. Again, this one is really broad. You can focus on drug abuse and addiction, drug side effects, adverse reactions, drug interactions, and medication adherence. So you can see that you can work with a lot of different committees that may already exist in your chapter. The goal here is to increase all medication awareness for the patient, why it's important that they take their medicine the way that it's prescribed, why it's important to let their doctor know about any other medicines, over-the-counter, natural products that they're using to make sure that they don't have any adverse effects. For ideas for events here, you could do medication adherence presentations at health fairs or community events, maybe at assisted living facilities in your community. Those places like to have guests come in and speak to their population, so that would be a good way for you to get your foot in the community as well. You could also work with Generation RX to create a variety of presentations, whether it be about drug abuse, drug addiction, etc. Also, if you live on a border state where counterfeit drugs may become a problem, you could hold educational sessions about the importance of the safety procedures that are in place for medication in the U.S. that are not in place in other countries. So really let them know why it's important that they do take medications from the United States. Next is the HIV and AIDS Awareness Campaign. This one's pretty self-explanatory, and it's really easy to come up with events for this one. The goal is very general: spread awareness and educate about HIV and AIDS. You can raise money for pediatric AIDS foundations. You can sell ribbons on World AIDS Day. You can hold educational sessions. My chapter recently traveled to Uganda to work at ART clinics to educate not only the patients but also the healthcare providers there about what is an adverse drug reaction or a side effect from the ART versus what is a secondary infection in that patient, so that they can identify what the medicine is causing and what they might actually need to treat with another medicine. Next is a humanitarian campaign. One part of this campaign is the Vampire Cup, which is a competition. So member countries of IPSF compete to see who can collect the most units of blood. The country that wins this award receives the Vampire Cup at World Congress. It's been a few years since the United States won this award, so I think it would be fun to really push this year and try to win it again at World Congress next year. There are two types of the Vampire Cup competition. The regular Vampire Cup is awarded based on how many pints of blood the country collects during the whole span of the Vampire Cup competition, which is several months long. The live Vampire Cup takes place about in the middle of the competition, and it's like a one-week live race. So as much blood as you can collect in that 1 week, you report it instantly as you collect more and more pints of blood, and whoever collects the most in that 1 week period also wins a Vampire Cup. They do ask that you partner with organizations such as the Red Cross that already do blood drives to do these events. You can partner up with your school, a community center. You just promote the event, collect the blood, and fill out the Vampire Cup. You can also host educational sessions about the importance of donating blood when you do the blood drives as well. So those campaigns are the campaigns that are promoted by APhA-ASP and that go into your report every year, but there are also other IPSF projects that you can get involved with. There's a few on your screen right now, and you can also go to IPSF.org and click on the public health link, and there will be information about other programs that you can get involved with. So here are your important fall project dates. They're all color-coded to go with the events on the previous slides, and there's one for each project. So be sure to your chapter's calendar and encourage your committees to try to have a fun event for each one of these days. If you're looking for inspiration or more ideas or just information about the projects that we've talked about, you can contact Nellie, our National Project Coordinator, and her email is on your screen right now. We'll show it again at the end. And she has information about the project. She may have more international handouts or information that she can give you, and more detailed information about a certain topic if you do want to present that to an international community or put an international spin on it. And she's also got all the forms to document the activities and events that you want to hold throughout the year. So moving back to the umbrella structure of IPSF, IPSF also has international collaborations with many international health organizations, including FIP, the World Health Organization, UNESCO, and it's really a unique opportunity to represent pharmacists as healthcare professionals on the international level with these organizations. Many of these organizations also have yearly conventions that students can attend, kind of like APhA-ASP annual. There's an annual conference for the Federation of International Pharmacy that students can attend, and you can also attend the World Health Organization's conference every year. And if you're interested in doing that, just contact a member of the International Standing Committee and they will get you more information about that. So now let's talk about the Student Exchange Program. On your screen now are some pictures from some of the incoming and outgoing exchanges this summer. The top two pictures are international students that came to the United States and were hosted in Boston and in Idaho. And the bottom two pictures are U.S. students who went overseas on an exchange this summer. So what is the Student Exchange Program? There are 50 IPSF member associations that participate, and it allows members of IPSF to apply and travel on exchange to other pharmacy programs. The most common exchanges are 1 month, but they can vary anywhere from 2 weeks to 3 months. During this time, you'll get 60 hours minimum of professional pharmacy experience while also getting cultural and social experiences that are planned for you as well. Again, all members of APhA-ASP are eligible to participate as exchange students, and all APhA-ASP chapters can create host sites for students from overseas to come and see pharmacy in the United States. This year, we hosted 38 students. We want to continue to increase this number because the more students that we host, the more U.S. students that we can send out on exchange. If you or students in your chapter want to apply for STEP, our pre-application cycle opens on September the 15th. So from the pharmacist.com website, there's a link to the pre-application. The deadline for these applications is November 1st. Please stress to your chapter members not to wait until the last minute because the application does require letters of recommendation and there's some short essay questions. Also, make sure that they're only filling out the APhA-ASP pre-application. They do not need to apply to the IPSF STEP database until they've already been accepted by the APhA-ASP International Standing Committee. So the way that we get to send more students out is by hosting more students. So how can you establish a host site? Well, it's pretty simple. First, you have to find preceptors to host them for 60 hours of professional pharmacy experience at about 15 hours a week. We have to stress that this is considered a shadowing experience. It is not an internship or a work experience. It's just shadowing, and that's really important for the visa issues. So when you're working on this, be sure to stress to your preceptors and your administration that it is just considered a shadowing experience. We also want you to plan social, cultural events, maybe a baseball game in your area, museums, or historical sites in your area. Then we ask that you create a welcome packet to tell them about your school, about your city, about the things that they'll be doing while they're there, and basically any information that you would want to have if you were coming into this situation, such as fun things to do, interesting facts about your city, etc. And then we also have a guide for creating a welcome packet on our website. If you want to establish a host site, the time to start that is now. So from now to December, we want to have the host site created so that in January, when we start trying to place exchange students, that we can have from January to May to place these students and have plenty of time for them to plan their exchange and get to you. Then the STEP takes place from May to August. There are currently a few sites internationally that offer winter exchange, but we do not offer that yet. So if you have students that want to participate but need to do that over Christmas break or December, they can do that internationally, but we aren't currently making host sites in the United States for winter exchanges, so it would just be in the summer. There are lots of resources on the APhA-ASP IPSF website for STEP. We have the STEP pre-application. There's a local exchange officer training manual which will help your local exchange officer through every step of creating the host site. There's a guide to creating a host site, and there's also an IPSF toolkit. The IPSF toolkit is really unique. It's a pre-made PowerPoint presentation that you can present to your chapter, and it also has a slide-by-slide notes page so that you can take this PowerPoint presentation that's been pre-made for you, present it to your chapter, have all the information that you need, and educate your chapter on participating in STEP, hosting an exchange student, as well as a lot of the other information that I've shared with you tonight. We also have a host site Facebook page so that once you've created your host site, you can talk with other students who have hosted students in the past, talk about ideas. You can talk to us if you have any problems, and there's a link to the Facebook page there, or you can just search for it in Facebook. Also, the STEP database does have lots of information about which countries participate in STEP, how STEP works, and some more frequently asked questions pages. Just be sure that if you direct your chapter members to this website that they don't apply through the STEP database, that they only apply through our pre-application section until we tell them to do otherwise. Then if you have any more questions, you can feel free to contact myself or Ashley at the email that's listed below. So back to where you fit in, there are also individual leadership opportunities through IPSF. Many of you are already the International Vice President at your chapter. You may be the local exchange officer at your chapter, or you may just be an interested IPSF chapter member that wants to get involved. Then beyond the local chapter level, there's your International Standing Committee. There's 4 positions there. There's information and applications for these on the IPSF webpage from pharmacists.com. Then there's also the IPSF international positions that we talked about, from members of the regional working groups to the different committees, all the way up to the IPSF Executive Committee. And APhA-ASP did have a member that was elected recently at World Congress. Jessica Zook was elected as the PARO region Regional Project Officer. So there are APhA members that are involved all the way up to the international executive level of IPSF. If you're not so much all about the international leadership opportunities, but you just really enjoy traveling, there are also some other opportunities for you. Next year's World Congress is going to be in Hyderabad, India. And then the PARO Regional Symposium, it's like World Congress, except it's smaller and it's just for our region, and that will be held in Argentina. And any APhA-ASP chapter member can go to these conferences. This shows you how to get to your resources, all these things that I've been talking about, from the pharmacist.com webpage. If you click Get Involved, then APhA-ASP, it'll take you to the APhA-ASP page, where you then click on Projects and Programs, and from there click on the IPSF link. You can also find us on Facebook. We're APhA-ASP/IPSF. We try to post there several times a week, lots of updates, reminders about upcoming events, and just keep you informed of what the International Standing Committee is doing for you on the IPSF level. And also, if you are an International Vice President, be on the lookout for a new International Vice President Facebook group where Adrienne can at you guys and give you information, as well as share ideas and connect with other international vice presidents to really get great ideas about new events that other people are doing and that you can put into place in your chapter. So here's our card. If you ever have any questions, comments, please feel free to contact any of us. All of our emails are on here. And if you're not sure which person to contact, just pick an email off the card and we'll be able to direct you to the appropriate person to answer your question the best. So thank you so much for attending the IPSF and You webinar. If anyone has any questions, I'll be happy to answer those.
Lynette, did we receive any questions?
We did. So the question is from Cindy, and she asks, can someone who already holds a chapter position be designated a temporary international VP until a vote can be held?
I think
Go ahead, Amanda.
Okay, I think that depends on your chapter's bylaws. But I know that a lot of chapters don't have that designated already. It is a new exec position within APhA-ASP. So that's perfectly fine with us. If there's somebody else in your chapter that's willing to take that on, that already has an office, that's fine. They can go for it. They can be the IVP as well.
All right. And I know everybody is wondering, the next question we had was, can we get a copy of the presentation? Yes, the webinars will be listed on the webinar link under chapter officer resources on pharmacists.com. We will have all the webinars listed there. So be on the lookout for that in a couple of days. And then we have another question. When does the Vampire Cup start? Our school is planning it on October 15th, 2014. And that is from, I don't want to mess up your name, but IKJAE.
I'll have to get with Nellie and find out the exact dates. They just gave the award at World Congress. I want to say that it's from January to June or January to July. That way the numbers are complete when World Congress gets here. If you would, please send me an email and I will forward that on to Nellie and she can give you more information. Also, if you go to IPSF.org and click on Public Health, you can go directly to the Vampire webpage and it has that information.
All right, and then we have one question from Zachary, and he asks, where can we find the Vampire Cup form?
Again, that's going to be another Nellie question. I believe that we use the same form that's listed on the IPSF Vampire Cup page, but I'm not 100% sure about that.
We do.
All right, any other questions?
I don't see any more, but if anybody else has any questions, more questions while Lucy is giving a couple of APHA updates, feel free to type them in and we'll get them answered.
All right, thank you, Lynette. Now, before letting you go for the night, we did want to give you some information from APHA headquarters. First, the APHA Foundation provides research that demonstrates how pharmacists can improve healthcare. Now, you can support the foundation by signing up for the 1953 Society. So pharmacists sign up and donate $1,953 per year. Us students, we're not going to do that, but you can sign up to donate $19.53 per year. This will go towards the APHA Foundation Scholarship Program that students can apply for each year. So you should definitely check out the 1953 Society as well as the APHA Foundation Student Scholarship Program. You can also get involved by taking part in the Pharmacist Care Campaign during American Pharmacist Month. As Amanda said, pharmacy profession awareness is part of IPSF as well, and you can buy a sign that says your name or your school's name to promote your dedication to patients. Next, we wanted to tell you about the Joint Federal Pharmacy Seminar. This seminar is a great way to get pharmacy professionals together to represent federal pharmacy. So if this is something that you're interested in, this would be a great way for you to learn about the federal pharmacy sector and meet pharmacists who are currently in the practice. Now, for a little reminder, APHA staff needs your updated chapter information. Although this is more for your chapter president, president-elect, and advisor to take care of, it is also important to you so that we have the correct information so you can receive the emails that you need to get. So when we send out emails to the international vice presidents, you can be getting those. A gentle reminder to your chapter leadership to get that information in would be very helpful. Now, I'm very excited about this next announcement, the mid-year regional meetings. We hope to see you all at MRM this fall. Here are a list of dates and locations. So if you haven't already signed up, you want to make sure you do so as soon as possible. We've had a couple of meetings sell out in the past, and we would hate for you to miss out on this amazing opportunity. MRM is one of my favorite meetings. It serves as a great place to network, work on professional and leadership development, and of course, meet and get to know the other amazing student pharmacist teammates you have in your region. Now, Amanda, if you could jump to the next slide to discuss the Pharmacists Provide Care campaign. If you have not done so already, please visit pharmacistprovidecare.com to join the campaign to achieve provider status. The next couple of slides show you that this website provides a lot of great materials for all student pharmacists to reach out to stakeholders as well as policymakers. There are state-specific resources for you to use, so if you aren't able to visit Washington, D.C., you can set up your own visits in your district offices as well. Again, visit pharmacistprovidecare.com to sign up. It's very easy, and it will only take you a couple of minutes. Finally, of course, check out what the amazing Communications Standing Committee is doing on Facebook, Twitter, YouTube, and more recently, Instagram. They're constantly giving updates, some of which are also specific to APhA-ASP IPSF. So definitely follow, like, watch, everything. All right, Lynette, did we get any other questions come through?
Yes, we did.
Okay.
We got one question from, okay, she's asking the same thing. We will have this recording because she missed the first half. We will definitely have this under webinars on the pharmacist.com under your chapter resources page. Give us a couple of days and we'll have that up and you'll be able to watch the whole presentation again. And then, yep, the same question. Will this PowerPoint be posted? So the PowerPoint will be posted. Just definitely check chapter resources page on the pharmacist.com and then the webinar link, and then you'll see all of the webinars from this whole week if you missed any that you want to see. I believe that's it. If you all have nothing to do, definitely come back. We have another webinar, the Leadership Development webinar at 9:30 Eastern Time. So definitely if you want to come back and get some more leadership info, definitely stop by for that webinar at 9:30.
Yep, that will definitely be a great webinar to attend. So if that's all for tonight, I think we're all set. Thank you to Amanda for presenting tonight, and thank you to all the attendees for joining us, and have fun with this upcoming year.